Our first speaker will be Professor Miho Sato. She is from Japan, and she is going to talk to us on, does smartphone use induce strabismus? Thank you.
Thank you, Sonal, and thank you very much for inviting me to this wonderful session. My name is Miho Sato. My topic is, does smartphone use induce strabismus? There is no conflict of interest. Acute acquired comitant esotropia is a rare strabismus of sudden onset. This graph shows the number of articles published per year using PubMed search with the terms of acute acquired comitant esotropia and smartphone. The number increased significantly after 2016, and it increased even more after the COVID-19 pandemic period. The first report mentioning the relationship between smartphone overuse and esotropia was published in 2016. And during the COVID-19 pandemic period, the incidence of ASCE increased. Therefore, the relationship between excess use of digital devices and ASCE was suspected. But there are some questions that need to be answered. How do smartphones affect our eyes? Who is likely to develop strabismus when using a smartphone excessively? Is it reversible or not? Most studies on ASCE are retrospective, so the onset of esotropia is vague. Then we started a multi-center prospective registry study nationwide. The study is to register the patient with acute onset of esotropia, teach them how to use the digital device, and re-examine their eye status 3 months later. Subject: patients are between 5 and 35 years old, and esotropia started within 1 year of their first visit. Exclusion criteria are as follows. Method: we asked questions about digital device-related lifestyles and strabismus onset. We measured best corrected visual acuity, refraction under cycloplegia, stereo acuity, alternate prism cover test at near and at distance. The spectacles were prescribed both for hyperopia and for myopia. Then the following instruction was given. Reduce screen time less than 60 minutes a day for younger than 12 years old, less than 120 minutes a day for 12 years old or older, and keep the viewing distance longer than 30 centimeters. Take a 5-minute break after every 30 minutes. Result: data was collected from November 2019 to December 2021. 218 cases were enrolled and 194 cases were analyzed. This is the age distribution. We classified them into 3 groups as child, adolescent, and young adult. The peak age was 16 years old. Male dominancy was found in all age groups, but it is most significant in adolescent group. Here are the refraction values by age groups. The patients were older, the myopia was stronger, especially in young adult group had highly myopic. Here are the strabismus angles. The angle at near was significantly larger in the child group than in the adolescent and the young adult group. Angle at distance was larger in the child group than in the young adult group. In addition, the adolescent and young adult groups showed a significantly larger angle at distance than near. This figure shows the time to visit an ophthalmologist. In the adolescent and young adult group, there were many who visited the ophthalmologist between 6 months to 1 year. So let's look at the result of 3 months later. Patients were divided into DD-, that is using the digital device less than 60 minutes a day for younger than 12 years old, and less than 120 minutes a day over and equal 12 years old. And DD plus patients are 156 cases, and they use a smartphone or digital devices longer than that. This is the duration of digital device use at the first visit and 3 months later. The duration of DD use decreased significantly in DD plus group, but did not change in DD minus group. This is the Strabismus angle at the initial visit and 3 months later. Strabismus angle of DD minus group did not change both at near and distance at 3 months. On the other hand, the angle of strabismus was significantly reduced in patients with DD plus group. However, the amount of angle reduction was clinically small. Then we studied the factors related to the outcome. The DD plus patients were divided into 4 groups based on their strabismus angle and subjective failing at 3 months. The best result is cure, then improvement, no change, and worsening. 10 patients were cured, 58 improved, 67 did not change, and 21 got worse. Here is the duration of DD use at the first visit, 1 month and 3 months later. Patients in the cure, improved, and unchanged groups significantly decreased in their digital device use time, but patients who worsened did not change the duration. Here are other factors relevant to the outcome. A short time from onset to clinical visit, a small strabismus angle at distance, and good stereo acuity at the initial visit are strongly associated with improvement. From these results, we believe smartphone or other mobile digital devices induce acquired esotropia, but it may not always acute onset of acquired concomitant esotropia, but some of them are so-called myopic distant esotropia. Myopic patients usually maintain distance to the digital device when they wear optical corrections, but when they do not wear them, the distance to the digital device becomes quite short and excessive convergence is required. In order to prevent both myopia progression and esotropia, keeping the distance to the digital device and taking a break while looking at the digital device are recommended. Here are answers to the question, how do smartphones affect our eyes? It causes myopia progression and excessive convergence. Who is likely to develop strabismus when using a smartphone excessively? Adolescents and boys. Is it really reversible or not? Rarely reversible. Take-home messages. Wearing appropriate optical corrections is mandatory. Once acquired esotropia occurs, early intervention is required. Lifestyle changes may be necessary. Thank you for your attention.